24%. That is the number that changed how scientists think about dogs. A meta-analysis published in the journal Circulation, one of the most respected cardiovascular research journals in the world, analyzed data from 3.8 million people across 10 studies. Dog owners had a 24% lower risk of death from all causes compared to people who didn't own dogs. Not people who exercised more, not people who ate better, not people who had more money or better healthcare access, people who had a dog. The effect was even stronger for people who had already suffered a heart attack. If you own a dog and you have had a coronary event, your risk of dying in the years that follow drops by 65%. 65%. That is not a lifestyle tip. That is a number that belongs in a conversation with your cardiologist. And almost no one is talking about it. Because here is the thing about that number, the 24%, the 65%, that makes it genuinely uncomfortable to sit with. Your dog has been doing this for you every single day. Not occasionally, not when you went for walks. Every ordinary evening on the couch, every morning routine, every moment they were simply present in your life. You have been receiving a medical intervention without knowing it, and it has been working. The cardiovascular finding is the one that gets the headlines. But in 2025, a separate team of researchers published something that may matter even more to most people. A study in Scientific Reports, published by Nature, tracked 16,582 adults over the age of 50. They followed them for 18 years. And they measured something most of us are quietly afraid of: cognitive decline, the deterioration of memory, the gradual dimming of the mental sharpness that makes us who we are. What they found was this. Dog owners showed significantly slower decline in memory, both immediate recall and delayed recall, compared to people who didn't own dogs. 18 years of data, 16,000 people, and the dog owners remembered better.
Here is the detail that makes the finding real. They also tested owners of cats, birds, and fish. Cat owners showed slower verbal fluency decline. Bird owners showed no significant cognitive benefit. Fish owners showed no significant cognitive benefit. The effect is specific. It is not simply about having a living thing in your home. It is about the particular demands, the particular relationship, the particular biology of living with a dog, the daily routine, the physical activity, the social interaction, the attunement. All of it appears to be doing something to the aging brain that nothing else quite replicates. And it has been happening to you for every year your dog has been alive.
So why does this happen? Why does owning a dog reduce mortality by 24% and slow cognitive aging? The honest answer is multiple reasons, working simultaneously across every day of your life together. The first is cortisol. We have covered this before in this series. Petting a dog produces measurable drops in cortisol, the body's primary stress hormone, in both the owner and the animal. Chronic elevated cortisol is one of the most significant accelerants of biological aging we know of. It damages cardiovascular tissue, accelerates cognitive decline, suppresses immune function, and disrupts sleep. Your dog has been chemically reducing your cortisol levels, passively, simply by being present, for the entire time you've owned them. The second mechanism is physical activity. Dog owners get up to 30 more minutes of exercise per day than non-owners, according to data from the American Heart Association. Not 30 minutes of intense training, 30 minutes of walking.
Sustained, daily, low-intensity movement, the kind that cardiovascular medicine consistently identifies as one of the most protective behaviors a human can have. The third mechanism is social connection. Dogs create social interactions that would not otherwise occur. Conversations at the park, connections with neighbors, the simple experience of not being alone. Social isolation is now classified by the CDC as a public health crisis, with mortality risks comparable to smoking 15 cigarettes a day. Your dog has been quietly protecting you from that risk too. And the fourth mechanism is routine. Dogs impose a daily structure, feeding times, walks, bedtimes, that turns out to be one of the most powerful predictors of both cardiovascular and cognitive health in aging adults. The biology benefits from predictability. Your dog has been providing it without being asked.
Now, here is where I have to be honest with you, because this is a science channel, and science is not a headline. The 24% number is real. The studies are real, but there is a competing finding worth knowing about. A 2023 study from Sweden, a rigorous longitudinal study of 8,352 dog owners and nearly 210,000 non-owners, tracked over 16 years, found something different. After adjusting for confounding variables, age, health status, socioeconomic factors, the mortality difference between dog owners and non-owners largely disappeared. The Swedish researchers suggested that the earlier studies may have been measuring something else entirely. Healthier, wealthier, more active people are more likely to own dogs, and those same factors explain the longevity difference. So, is the 24% real, or is it a statistical artifact? The honest answer is we don't know for certain. What we do know with considerably more confidence is the mechanism. Cortisol reduction is measurable and has been replicated dozens of times. Increased physical activity in dog owners is measurable and well documented. Slower cognitive decline over 18 years in a study of 16,000 people is a finding of a different quality than a mortality meta-analysis.
And here is what I think is more important than the headline number. The question is not whether your dog adds exactly 24% to your survival odds. The question is whether the biology of living with a dog, the cortisol, the movement, the connection, the routine, is genuinely doing something to your body and your brain. And on that question, the evidence is not ambiguous. It is. Something real is happening to you because of your dog. The exact size of the effect is still being measured. The effect itself is not in question.
Here is the reframe that changes how you see the animal beside you. You have been thinking of this relationship as something you give. The food, the walks, the vet visits, the cost, the time. You give, they receive. But the data says something more complicated is happening. Every morning, they got you out of bed for a walk you might have skipped. Every evening, their presence in the room brought your cortisol down without you asking. Every routine they imposed kept your brain doing the one thing that protects it from aging, living on a schedule. Every social interaction their presence created, at the park, on the street, with the neighbor you'd never have spoken to, was a microdose of connection that the science now tells us is as protective as medication. They were not just receiving your care, they were providing healthcare. Quietly, continuously, without any of the recognition that a doctor or a trainer or a therapist receives, just by being there.
Just by being a dog. The 2023 JAMA Network Open study found that for adults living alone, dog ownership specifically offset the cognitive toll of social isolation. The people most at risk, alone, aging, disconnected, were protected most by having a dog. Think about the people in your life who live alone and have a dog. Think about what that animal has been doing for them. The next time you look at your dog and feel the uncomplicated weight of how much you love them, let yourself also feel the other thing, the thing that is harder to name. Gratitude for what they have been doing to your body and your brain every ordinary day for as long as they have been alive.
So, what do you do with this? The good news is that you are already doing most of it. The daily walks, the presence, the routine, You built those into your life when you got a dog, and they have been working on you ever since. But there are 3 things that the research suggests are worth being intentional about. The first is the walk. Not every walk needs to be long, but the research is clear that daily, consistent walking, the kind that dog ownership imposes, is one of the most significant cardiovascular interventions available to a human being. If your dog's walk has been getting shorter or skipped on the days that feel too busy, the biology suggests it is worth prioritizing. Not for them, for you, and for them, for both of you. The second is the presence. The cortisol reduction that dogs produce is most pronounced during actual physical contact, petting, close proximity, mutual attention. If your evenings have been spent in the same room as your dog, but not with your dog, phone in hand, screen in front, the mechanism is still operating, but at reduced capacity. 10 minutes of actual contact with your dog reduces measurable cortisol in both of you.
10 minutes. That is available to almost anyone. The third is the social extension. Your dog is a social catalyst. They create conversations and connections that your biology needs. The dog park, the neighborhood walk, the daily interaction with other humans that dog ownership generates, all of it is doing something that loneliness statistics tell us is genuinely protective. And the final thing, which is perhaps the most important, is simply this. The next time you sit down at the end of a day and your dog comes and settles beside you, let it be more than a moment of warmth. Let it be what it actually is. A biological event. A measurable reduction in the hormones that age you. A stimulus that is at this very moment doing something real to your cardiovascular system and your brain. You thought you were the one taking care of them. You were both taking care of each other. You just didn't know your half of the deal. If this changed how you see the animal beside you, subscribe and tell me in the comments, how long have you had your dog? Because based on the research, the answer to that question is also the answer to how long they've been working on you.